Productive Dentist Academy Podcast Network.
A new philosophy of care can increase your productivity per hour by $400, $500, $600 an hour, which is $400, $500, $600, $700,000 a year in production and collections. Dentistry is not about speed. It's not about how fast you can do things. It's about setting up your day so that you have maximum effect. Now, people will say, do you keep the patient in the chair for 4 hours if you're doing 2 crams? No, but the patient and my team member, my treatment coordinator, have plenty of time. There is no rush.
Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
Today, we're going to talk a little bit. I've had some great questions from listeners across the country, and I wanted to share my thoughts on some of those. One of the questions was, as a startup practice, how can we implement scheduling to productivity from the start? And that's a great question. And by the way, if you did that, if you started scheduling correctly from the beginning, not only will you get to profitability faster, but your productivity is going to increase significantly from the get-go. But the first thing you need to do, how to do it, you need to have a total understanding of what does it mean to schedule based on productivity, not time. And, we've talked about that in the past. And when you're first starting out, you're going to have a lot more examinations. You're not going to have as much clinical dentistry to start. One other thing that I would say that is critical is not only to schedule to productivity when you're beginning a startup practice, but to begin with comprehensive examinations. The combination of a comprehensive exam and scheduling to productivity, you can't go wrong. The clinical skills, those are going to come. You're going to recommend to patients what you know and what you've trained for. And just because it's a startup practice doesn't mean you're, this doc's straight out of dental school. You can be out of school 10 years and do a startup, 20 years and do a startup. So, but you have the opportunity to do it, what I believe is right from the get-go. And that's super important. So by scheduling for comprehensive exams, anybody over the age of, say, 25 years old, those patients should be seen by the doctor first, regardless of whether they say, oh, I just want to get my teeth cleaned. Well, you may just want to get your teeth cleaned, but that's not the way our practice runs. Dr. Baird wants to meet you. He wants to get to know you, and he'll make recommendations. And as a matter of fact, we will be able to get your teeth cleaned today or next Friday or whatever day it is, because we're going to schedule that as part of our scheduling template. The scheduling template will have the exam. It'll have the exam process. And then after that, whether it's an hour, hour and a half, if I was first starting out, you can schedule an hour and a half. Take a full series of x-rays, imaging, do all the things that you're going to be doing in your new patient exam, and then have a block right after that in hygiene. Now, if that patient comes in and needs dentures, and that should be picked up at the front desk first. The front desk could say, okay, plus they're not going to be calling in for a cleaning, more than likely. But if somebody does call in like that, they're going to still be able to be seen right after that for their appointment. Most docs, because they don't have a policy or they don't have a scheduling template, it becomes something to where that somebody calls up and the front desk goes, oh, okay, I'm going to put you in for hygiene first. I said this years ago, we did a marketing campaign, unbeknownst to me, that actually had a special for cleanings. And we had a lot of new patients coming in, and I didn't notice what was going on, but our productivity dropped 23% over a period of a couple of months. And I'm going, what's going on? And what I found was, hey, they were scheduling patients straight into hygiene. And I didn't notice it. I was busy, doing what I was doing. But that's the significance of scheduling to productivity and having the schedule templated properly. So you'll have your new patient. You're going to do a comprehensive exam, present total treatment, like we've talked about in multiple different podcasts, and we'll be doing it some more. But you can go back and look at the titles of our podcast. And kind of pick up on some ideas that will help you in this comprehensive exam. Then you're scheduling the patient. What if they needed 3 crowns or 4 crowns? Remember, dentistry is going to get expensive the longer a patient waits. I tell patients, we better hurry and get it done now because I've been doing this for 40 years and it's always been more expensive next year than it is this year. But for the most part, if we're marketing to the right people, then what we're going to find is that they actually need the dentistry that we like to do. And so if I scheduled, let's say I had 2 crowns to schedule, and if you're starting out in a startup practice, your production per hour, I would start out my production per hour at $475 or $450 an hour. And what does that mean? Well, that's the national average. So I want to have I don't want to start out less than that. Now it's true. It depends on new patient flow. It depends on location. It depends on all those things. But I would say start out at $450 to $475 an hour. Then what would happen if you did schedule? What if you scheduled these 2 crowns and they were $1,500 each? That's $3,000. How long would you want to schedule as this startup practice? It's $3,000. Let's just say it's $500 an hour as your goal. In our philosophy, you're going to schedule 6 hours for that procedure. 6 hours to do 2 crowns at $1,500. If you charge $1,000 for the crowns, how long? You're gonna schedule 4 hours. And people always say, Bruce, why on earth would you schedule 4 hours for something that's $2,000? Well, and it's only going to take me 45 minutes. Well, the reason is because I set a goal. And I only have 2 goals in the practice. One is to reach my goals, and the other is, as I've said many times, is to take great care of the patients. And by following this protocol, as opposed to doing, doing the slashes and X's where doctor's time, assistant time, and trying to book it that way, what you're going to find is you're booking that where you're booking the least efficient system that there is to book. Dentrix calls that perfect day scheduling. Why is it inefficient? Well, because as soon as you get behind, as soon as that tooth turns into endo, or as soon as that tooth turns into something more involved, guess what? You're running behind. And even worse, if you're scheduling new patients in hygiene, now you're running behind and checking hygiene patients with no time to actually do a comprehensive exam and tell them what they really need to have done. And so what does this lead to? And that's why startups, man, you got the opportunity to do it right from the get-go. That's awesome because, you're going to be able to tell patients what they actually need without worrying about cost, without worrying about any of those things. Otherwise, the reason that I say most docs are $475 an hour, national average, the reason they're there is because they're seeing new patients in hygiene. They don't have time to tell the patient what they really need to have done. They don't get to evaluate their aesthetic risk, their functional risk, their perio risk, their biomechanical risk, their physiologic risk. They don't have time to do any of that because hygiene's already running behind because you were running behind going to check them. And so what you end up doing is the Crown of the Month Club or the Crown of the Year Club. So you see a new patient, you market, you go out in the marketplace and everything else. And I don't care if you're a PPO, I don't care if you're a fee-for-service practice that does external marketing. It doesn't really matter. The systems are the same. If you're checking hygiene for new patients, you're going to find yourself behind the eight ball from the get-go, and you're going to become a toothodontist. 95% of all crowns are done in the United States one tooth at a time. Why? It has nothing to do with whether people can afford it. It has nothing to do with anything except the fact that you don't have the time to go in and do a comprehensive exam. So what you do is you pick the low-hanging fruit, and you say, this is the one we want to do today. This is the one, Bob, it's time, and they go, okay, let's do that one crown. As opposed to breaking things down and going through our scheduling to productivity courses and going through to understand exactly the process that you want to follow. And one other thing that's super important is having your team calibrated. We're starting a program called Clinical Calibration Institute, which having your practice calibrated means the front desk knows exactly what's going on in the practice, what your philosophy of care is, your hygienists do, your chair sides, which are the ones who schedule. We don't schedule from the front, we schedule from the back. And that's where things happen. And, I don't expect my front desk to answer the phone and somebody asks, what do they ask the question? I need to get in for what Dr. Baird told me. I needed to get that crown done. And they pick up a dart, they throw it up on the schedule, and they say, how about Wednesday? In other words, there's no rhyme, there's no reason to why we do what we do. And what I want to do is structurally put something together that allows me maximum productivity, maximum profitability. And when you do that, what you end up doing is you end up growing your business so much faster. And as a startup, again, perfect time is to do it right from the beginning. And so people always say, should I come to PDA? Should I learn this? Absolutely. That's the time to come. But I will tell you, if you've been at 25 years and you're not scheduling the productivity and you're seeing patients in hygiene first, a new philosophy of care can increase your productivity per hour by $400, $500, $600 an hour, which is $400, $500, $600, $700,000 a year in production and collections. Dentistry is not about speed. It's not about how fast you can do things. It's about setting up your day so that you have maximum effect. Now, people will say, do you keep the patient in the chair for 4 hours if you're doing 2 crowns? No, but the patient and my team member, my treatment coordinator, have plenty of time. There is no rush, and I've told people, my first 20 years in practice, I think I just ran from room to room saying, I'm sorry, I'm running late, because that's what I did. I still produced a lot of dentistry because we had so many patients. But I tell you what, when I changed the way I did it, all of a sudden, and as many of you know, the last 14 years in practice, I worked 2 days a week, but was able to produce over $2 million a year. And that comes down to other issues. But when your whole team is calibrated and everybody understands case acceptance and how that all fits in the new patient exam, how it fits in seeing a regular schedule patients, when they understand that, first of all, stress levels go down across the board. Your team is less stressed. You're certainly less stressed. And guess what happens to production? It goes up. And what happens to collections? It goes up. Because nobody has time in your office during the day to call people who owe you money because they're so busy and you're running behind. So anyway, that is a question from a listener. And please send me questions to bruce@productivedentist.com. And I'll do a special podcast specifically on your question. So I look forward to the next one. Thanks for watching us and listening to us. And check out the Clinical Calibration Institute. You can go to productivedentist.com and look at it. It is anywhere from $695 to $995 per month for your entire team training. which the team training includes training docs, training hygienists, training associates, training chairside, training administrators. So, and all of that in separate, categories. Tons of content, and for less than the cost of a crown a month. So, we're super excited about it. Let us know. Go see us at productivedentist.com. Look forward to the next time.
Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.